we have a renowned endocrinologist, Dr. J.V. Chanukya, today with us. So we are going to discuss on diabetes management with sir. So we will get to know about sir's overview and opinion with regards to how to manage diabetes and what all evolution has taken place in diabetes management. So sir, good morning.
Good morning.
Sir, would like to know from you, will I need to be on insulin for rest of my life if I am diagnosed with diabetes?
Usually it is a fear, that is one of the dreaded fear among our patients, that once they are on insulin, it is forever, lifelong. They feel it as a death sentence. Actually it is not so. Insulin with its advancements, and actually why people fear insulin, it is because of injection and it is associated pain. So in pain what happens is that they feel that they somewhat threatened, they reached the fag end of their life, all these things are going to happen, but it need not be. Insulin is definitely a life savior, means it is going to save from us complications, not only from death. And with advancement in needle technology, especially with the fine needles of 32 gauge and onwards, and almost painless injections. Coming to second part of the question, once you are on insulin, whether that patient need to be on insulin forever? No, it is not so. With good lifestyle modification, that is diet control and exercise, we have seen around 10 to 20% of patients can be weaned off insulin, albeit under the guidance of endocrinologist. How much they require daily, we have to decide. We'll hold this. The second question will go.
So the second question is, so sir, the second question is with regards to the keto diet. So what is...
One fellow is not leaving me, I think.
So the second question is with regards to the keto diet. So sir, what is your opinion with regards to what is the role of keto diet in diabetes management?
Keto diet has been in vogue for a long time, almost now a century we can. So it was promulgated by, we completely avoid carbohydrates and put on total fat diet, associate a bit of protein, definitely our body will end up in catabolic state, means body slowly dissolve its fat stores, and thereby over a period of time sugars are going to come in control. Yes, in fact it happens, sugars are going to come in control, but the main problem is that our body as a metabolism requires three basic primary factors: carbohydrates, fats and proteins. Carbohydrates account for 40 to 60% of our daily requirements. Carbohydrates should be present in our diet, but when they are going to reintroduce, that is one of the area where many people differ. Nowadays we have seen this field is occupied more by quacks rather than certified nutritionists, because unfortunately there are only very few centers like the National Institute of Nutrition with registered dietitians. So on popular media we can find quacks promulgating this keto diet. Initially they are going to lose weight, initially glucose levels are going to control because they are not going to take any carbohydrate, and some people can be taken off insulin, but for how long? And are these people going to live in the same situation? No, because again they have to switch back to little amount of carbohydrates. So when that happens, again we have to be very judicious in introducing, because sooner or later, say 6 months or 8 months or longer term follow up is necessary, because in our mindset we are happy that we want quick results. Say for 6 months, 8 months our sugars are well controlled with keto diet, and after that we often see on TVs or social media these success stories, but we don't see these failure stories, because most of the people who fail these diets, they don't come to TVs or social media to tell their reality or facts. That's why these quacks still exist in our world. Thank you.
So the next question which most of the people wants to know is with regards to, once we are diagnosed with diabetes, can we get rid of it? Like your opinion with regards to people who are diagnosed with diabetes,
remission,
can get rid of it?
That is popular known as diabetes remission. It is a catchy term nowadays. And again, this field is by quacks rather than doctors, because ignorance is a bliss. And in ignorance, many people claim that by strict control of sugars and or avoidance of sugars and carbs, one can ameliorate diabetes. Again, it is like another quack diet, or we can say snake oil or quackery. Definitely, lifestyle modification and regular exercise in some individuals, definitely diabetes is going to remission. But what is meant by remission? There is no universally cutoff of remission. Whether HbA1c should be less than 6.5, whether HbA1c should be less than 5.6 or 5.7, or GTT should be normal, that is glucose tolerance test, nobody knows. Subject to opinion. So, if for expert says, if GTT is normal, HbA1c is normal, even after 1 year of strict diet control, one can say it is in remission. But nobody has done such studies so far.
Sir, the next question is with regards to what are the best food which we can have before and after exercise, or what is better, whether exercising is better or dieting is better?
Yeah, dividing this question into two parts. First part is about which food has to take before exercise. Before exercise, usually we have to check our blood glucose levels with the glucometer. That is the standard procedure. If you are not checking with the glucometer, sometimes either you might having hyperglycemia, that is high sugars, or sometimes hypo. It is called low sugars. If blood glucose levels are 100 or so, definitely you can have 15 grams of carb, just let's say one slice of bread or one fruit or 2 or 3 marigold biscuits. On other hand, already glucose levels are in euglycemic range, that is between 120 to 180, no need to take anything. On other hand, if glucose levels are high, say more than 180 and 200, definitely we have to think of it, whether to postpone the exercise or decrease the intensity of exercise. It all depends upon the ambient, that is prevalent blood glucose levels. It is not a must that you have to consume something even if glucose levels are more than 200 before exercise. And coming to second part of question, that is which one is better, diet or exercise? Both are important, but to succinctly say, that is in brief, for immediate quick results, exercise is better. For long term results, diet control is better. So, if you want quick results and long term results, and which you want sustain, because both are synergistic in nature, because they aid in each other in controlling blood glucose levels, you should do exercise daily, at least 5 days in a week, as recommended by American Diabetic Association. The duration they recommend is at least 20 minutes per day of moderate intensity exercise, just like jogging, running, that means at 6 kilometers per hour speed for at least 20 minutes per day. And diet control, that already we have discussed. Diet control is not that something extraordinary diet is going for diabetes, it is usual ordinary diet what we are going to consume at home, but at regular intervals, not to skip the timings. For example, somebody skips breakfast, it is not advisable. If somebody is going to skip dinner, that is not advisable. You should have variety of foods in your diet, then only one can sustain with the diet control. If you are sticking to only one diet, say a few chapatis or a few curries, kind of those things, it will become monotonous, and over a period of time we are going to abandon that thing.
Thanks sir, thanks a lot for sharing your opinion.
Thank you.